Okay, you were dispatched for a trauma at a construction site. It's reported that a construction worker fell off a ladder. It's reported to be an 8-foot ladder, so it's really not that tall. But he's reported to be unconscious, and he fell on a piece of metal, and it's sticking into his back.
Okay. So first of all, he didn't fall from so high. It's an 8 foot ladder, and he's pretty tall. So, well, number one, we're going to take our standard precautions. We never forget about that. Make sure the scene is safe. In this particular situation, safe would probably be make sure nothing's falling from the building on top of your head. I don't think we're worried about gunshots here, but it's a construction site. The scenario could be very unsafe. So make sure it's a
Hmm.
safe place to work. Once
Yeah,
you make sure it's safe to work, you're going to obviously try to figure out what the mechanism of injury is. In this case, you're saying we clearly see a piece of rebar sticking right into him, and he fell
hmm,
down.
yep,
So that's the mechanism. That's the possible mechanism of injury. Obviously, we're not going to be married to that
yeah,
mechanism of injury, but that's what we see. We'll try to quickly get a general impression of what's going on here. Request more backup units to respond here.
yeah,
Um, Obviously, right away we're gonna see do our AVPU, try to just figure out is he alert? Is
yeah,
he responding verbal to painful stimuli? We are going to for sure bring our C collar with us because he fell.
yeah.
But
Let me give you the what you see when you get on scene. So
okay,
you arrive, you see several other coworkers around this gentleman. He's lying on his side. When he fell on a piece of rebar. It's about, let's say it's about 14 inches long, and it's sticking into his back about 4 inches on the lower left flank of his back, above his hip. He's lying on his side, and he's moaning in pain. And so he is
he's
alert, actually.
alert. He's alert.
Yep.
Okay, so in that case, obviously, we never remove anything that's sticking into somebody. So we're going to. I would call for probably for the fire department because I'm probably gonna need them to cut him out of that at some point. So
It's
we could.
it's actually it's actually a loose piece of metal, so
Oh,
we
it's
don't have
loose.
to
Okay, you're
cut
making it
anything.
simpler. Okay, so
Yep.
we're going. So first of all, again, we're going to try to get a quick assessment. And you're telling me he's alert, and I'm going to just make sure that check his pulse and his breathing, just to make sure that his breathing is adequate,
Okay.
and that he's obviously has circulation if he's alert. But we want to make sure that he's breathing okay. So I'm going to make a quick general impression, and like we spoke about before, I will do quick, vitals. I'll probably have the O2 meter on him. I will just to check that. I will check his pulse, see what's going on with that, just to get
Okay.
a.
Okay.
Um,
So you check for a pulse. He has a pulse of 88. He has SpO2 of 97% on room air. His blood pressure is 142 over 92, and his respirations are 20 and non-labored. He's a little bit anxious about what's going on. Um,
so
what
his
else are you going to check with the ABCs with that circulation? The C.
well, the key here is bleeding. Obviously, even if he didn't have circulate, even if he didn't have a pulse, bleeding is more important than anything. So the
Yeah.
first thing we're going to try to do here is try to see how we can stop the bleeding. I mean, or see if there is bleeding. That's the first thing
Okay.
I'm going to do when we get on scene is see for the bleeding. Obviously, the rebar is in a spot where we can't do a tourniquet, so it's not going to be an option to use a tourniquet. But we're going to take as much gauze and pack the wound as much as possible
Okay.
um, to make sure we can stop the
So
bleeding.
there's very little associated bleeding, like a trickle of blood coming from the around the rebar. It's still in him. You mentioned not removing the rebar. Is there anything else you want to do with it?
I want to secure it. I don't want that thing moving around. So
Yeah.
we're going to use the gauze and the roll to kind of secure it in place so it's not
Okay.
moving. So the
Okay.
hospital could deal with it. If it starts to move more on our scene, we're going to be in trouble.
Okay.
In this case, you're telling me there's not a lot of blood. So the number one thing that I would be concerned about is internal bleeding.
Okay.
Um, his vitals are pretty solid.
Okay.
considering at this point. So I'm
Hmm.
not like gonna think right away that there's any sign from the vitals of internal bleeding, but I would, look around. A lot of times with internal bleeding, you'll see like big bruising all over. You're going to check for that and, touch around that area to see what's going on with that.
Okay.
Check
When
for
you
internal.
when you touch the abdomen on the other side, it's a little bit painful. Of course, it's not all the way through. It's tender, and you're not able to push hard enough to feel rigidity because of it hurts him too bad. So he cries out in pain.
So I'm going to assume that there is something going on underneath there.
There could
Um,
be.
there's definitely, I mean, there probably is something going on underneath there, but um, there's at this point, I mean, we would definitely want to transport as quickly as possible. There's nothing for us to really do there. I mean, we would take his vital signs again. At this point, I mean, again, this is always something I don't know when to give oxygen. It seems to always give oxygen, but in this case, again, his O2 was great, his pulse was great, everything was great. I would keep reassessing that to see if anything changes. If anything changes, I will definitely put him on oxygen. If it's not, if it's even if his
Okay.
O2 starts to go down,
Okay.
um, I do want to make sure that we do a regular assessment as well, because maybe he fell because he had a cardiac incident, or maybe he fell
Yes.
a stroke. So we're
Thank
not going to
you.
we don't want to let a trauma, dramatic situation blind us from our regular, sample OPQRST or whatever it may warrant in this case, and to make sure that we do that. And once he's verbal, I'm gonna say, what happened? How did we get here? What's your sign? What are
Okay.
you allergic to anything? Medications?
He says he was up on the ladder painting, and he uh he lost his balance. He got a little dizzy and lost his balance. Uh there his signs and symptoms are, he's got a rebar sticking in his back, uh and he's in a lot of pain. He has no allergies. He doesn't go to the doctor very often, and so he doesn't take any medications. He knows he has high blood pressure. He's a 54-year-old male, and he has had lunch about an hour ago, ham and cheese sandwich with a cup of coffee, and then the events leading up to it is that he got dizzy and fell off the ladder.
So I definitely would take his glucose because I want to make sure he doesn't have any issues with that. That could easily have caused him to get
Okay,
dizzy. And
comes back at 172.
so that's pretty high. Um, but it's not like crazy.
Correct.
Uh, so I don't think it's going to warrant anything as far as making any moves on that. But I would definitely keep that in mind.
Correct.
Um, so yeah, so we checked his glucose, we his blood pressure. We check this again. We want to make sure his vitals are good again. Um, I would, again, like I said, I would. We didn't get any history from him of anything that could cause this. I don't think he told me anything, right? Just that he ate recently and he wasn't on any medications, right?
Correct.
And he's no allergies to anything. So again, I would ask him if he has any pain anywhere. When did this? What, was there anything going on before this? Was there any pain? Was there any?
When he landed on the ground, he landed kind of on his well, he landed on his back, and then and the rebar, and his left shoulder is feels very painful. It's like it dislocated.
So
So
again,
he's in
that
a lot of pain.
so two things. First of all, I think at this point we would be transferring him, because the main issue is the fact that he has rebar in him, and that if there's internal bleeding, that's dangerous. So this guy's
Yeah.
going. This guy's
Yep.
going. But as we're transferring, we would do this secondary assessment where I would go through his entire body, to check every single part of his body, because if he fell, the rebar could just be one piece of the puzzle. He could have broken bones. He's specifically complaining about a possible dislocation. Um, I want to say, which arm did you say that it was? The left or the right?
The left arm, and he's lying on that left side when you arrive on scene, and that's where he feels most comfortable. Don't move him a whole lot. He's in a lot of pain, but you can't really roll him on his back because that rebar is sticking out of it.
Right. And but his breathing is fine, right?
Mhm.
Right. So no, because I want to, because he probably has a dislocated shoulder. I think the most we can do for him is to, again, he's lying down. I can't really put a sling on him. There's nothing really to
Yep.
do for that. I was going to go down the route of possibly figuring out if he has any uh, maybe tension pneumothorax, something going on that's
Okay.
causing the pain up here. But
How would
you're
you
saying his breathing is
determine
fine,
whether
everything's
he had a
fine. So
pneumothorax or not?
I would listen to his lungs. First of all, that's
Yeah.
one of the things I do, listen to his lungs. If I
Okay.
see a different, if it's not matching up properly, um,
Okay.
that could be a problem. Because he did get a penetrating, but you said it was further down, so
Yes.
it probably didn't hit his lungs, but
Yep.
there could be blood pooling around his heart. I mean, anything.
Yeah, no, you're digging and you're getting in the weeds a little bit. You're absolutely correct, and you need to do that secondary assessment. And I love the fact that you're going to assess for that pneumothorax and do lung sounds. And I'll tell you that both lung sounds are clear and equal bilaterally. So there is no pneumothorax.
Lung sounds clear.
And I'm not trying to make this overly complicated. I want this guy to have a shoulder that's hurting, and I want this guy to have a piece of metal in his back that's hurting. So
No, so again, I'm gonna double check to make sure that he's not having another issue that's causing that pain in the side. That possibly like a cardiac tamponade or something like that.
okay.
Check to see if his jugular vein is popping out over there. I'm
Okay.
gonna check his heart to see if there's muffled heart sounds. If there's muffled heart sounds, that could be a cause of that as well. We did say that his blood pressure was high, not low. So I think hypotension would be a cause for that. And so I would write that off as well. I don't see that as being a problem. Most likely he has a dislocated shoulder or something like that.
Okay. So you mentioned that good thorough assessment. Why don't you go ahead and do that for me and tell me what you're looking for as you move down through each body system?
So I'm gonna go from head to toe. So I'm going to feel the head, the neck, the scalp. I'm gonna look visually to see if there's any battle signs because
Yeah.
he could have gotten a concussion as well from the fall. So that's what I'm gonna do. Check his nose, check his eyes, look inside his eyes. Um, I'm gonna feel his jugular, which we already did before. His spine around the back of his neck. Inspect visually his chest, palpate the chest, which again, we did that a few times as well, just to make sure we did find the tenderness on one side. So we are suspecting there's something going on underneath there. And we're speeding along to the hospital now to take care of that. But we're going to continue down on all over his abdomen, um, and feel everything. We did our lung sounds, we checked for that as well. In the lower extremities, we're going to palpate and check motor and circulation on all different extremities to make sure that there's circulation everywhere and that he can move everything around. Um, Palpating and checking for any contusions or anything, any other, bleeding or something going on in any other part of his body. Any deformities, any abrasions, any burns. Maybe he got a burn from falling. He burnt part of his foot off. I don't know. Any swelling, tenderness, lacerations. We're just going to make sure there's nothing else going on besides everything
Yep.
um, that we already got. And again, we're going to be managing that wound that he does have. And at this point, I always like this. The way I look at it is like when we're done the assessment, we come back to where we started and say, okay, we're focused back on what we have, which is this guy with this wound, and we're going to get him to the hospital as quickly as possible. And we'll double check. At this point, I probably double check his vitals, make sure nothing changed. If
Okay.
everything's still okay, then we're good to go. At
Okay.
least we are. I don't know about him.
Yeah, for sure. So there's a time to do a full patient assessment, full head to toe secondary assessment, and this patient qualifies for that. There's also a time to do a focused assessment for someone that was, just broke their arm or just burned their hand. We don't have to do the full head to toe.
Right.
So good job on that.
Anytime
Uh,
you have a fall and a possible internal bleeding, I think you could suspect there's a million other things that happen. But if this guy
it
just
could
put his
be.
hand in the fire, you're not going to say, "Well, I have to see if your toes are okay." I mean, we know what happened.
Exactly.
Yeah,
Exactly. So with this guy, don't forget about the pupils on the face, on the eyes,
yeah.
and so his eyes are pupils are pearl, which is, you remember what pearl stands for?
No.
Pupils are equal, round, and reactive to light, which is a good
Oh,
thing. That's what you want.
well, yeah. Okay, fine. Which is pearl. Yeah, yeah.
So
I never knew it as pearl, but yeah.
yep. So his trachea is midline. There's no JVD. There's no pain on the ribs. Uh, there's there's no trauma anywhere else except for the back, where that rebar is, and the shoulder overall. So, all right, you're now arriving at the hospital, or the medic arrives. Go ahead and give me a verbal report.
Okay, so we got called out to a 54-year-old male who fell from an 8-foot ladder on a construction site. When we arrived, we saw a piece of rebar sticking out of his left lower quadrant through the back. We did an initial assessment. His pulse was 88, his O2 was 97, his blood pressure was 142 over 72. Um, his breathing was 20, so he had that was our initial assessment. Um, his glucose level was 172. We packaged them up. The rebar is still sticking out over there. We did well. We don't have the numbers on all the secondary. We did a secondary assessment. He has no medical history that we know of. He's not taking any medications. He ate about an hour ago. He did complain about being dizzy before the fall, but we didn't find anything to support, what the cause for that may be. Um, and we took his lung sounds were clear, both sides. Um, we reassessed, we didn't find any deformities or any contusions, abrasions, or anything on his body. And when we reassessed his pulse and blood pressure, he didn't tell me the numbers, but they were all the
Yep.
same.
Yep.
They were also, and we did not do any other um, interventions.
Yeah. All
Um,
right.
yeah,
As I said before, the more you do, the more you'll get better.
right.
You said that he didn't have any medical history, but I told you that he had high blood pressure.
High blood pressure.
That's it.
Yeah, I
So,
forgot about that.
okay, let's go back through it. Not too bad, pretty good. It was kind of a messy trauma, but you really weaved your way in and out and did a lot of good things. You stabilized that rebar. You address C-spine. Uh, it's hard to put someone in full C-spine precautions when they're lying on their side, but that's okay. You mitigate it the best you can. The You got vital signs early. You check the ABCs early. Excellent. Sample history. Excellent. The blood glucose being 172, yes, it's higher than normal, but it's not a level that really concerns me. This is a guy that says, I don't go to the doctor very often. I know I have high blood pressure. He's 54. It Having a high blood sugar is nothing that concerns me. He's probably on his way to being a diabetic and has high blood
Pre
pressure or high
pre-diabetic. Yeah.
glucose. Yep. One thing that would have been advantageous is to obtain the OPQRST. I kept saying that he's in severe pain, in a lot of pain. And that's kind of a clue like, hey, get the severity of that pain while he's laying on the ground, while you're moving him, and then ultimately when you have him on the gurney in that last position of comfort. So that's where a medic's going to arrive and give him some pain medications, hopefully, and
IV.
start an IV and do any fluid resuscitation that's necessary. At this point, There's no indication of internal bleeding, but there's a possibility with that rebar being in the abdomen. Now,
Right.
the area I was trying to portray that rebar being in, that lower left back, that left flank, you have the kidneys back there, and then it kind of comes up into your
Flank.
intestines and stuff like that. So, all it could be a multitude of things that are interrupted in there and injured, but that's not really for you to determine ultimately or diagnose what was injured, just locating what's there and where it's at. So, um, let's see. Yeah, not too bad.